Thanks, Minister. I spoke on this a number of weeks ago, and I've asked to speak on it again today because I think it's going to be a hugely important issue in terms of into the future in particular. We're probably going to live with COVID for as long as we can remember. It's like no other pandemic. It's probably into maybe for the rest of our lifetimes, COVID is going to be on the horizon in some shape or form. You're going to have potentially lockdowns required at a point in time. Life is not going to be as we know it. And really what I want is, Minister, I think the role of mental health services, it's basic trust in terms of the service they provide will be the same. However, I think it has to be COVID proofed. So I suppose the questions I have for you, Minister, is the vision for the actual current document, that's the policy document in terms of sharing the vision. Is that COVID proofed? Have you set up, I see you have a National Implementation Monitoring Committee. So the actual thing of sitting down and saying, if we're going to have a world where we're going to have lockdowns, or we're going to have colleges closed, people can't go to daycare centres, people can't attend school, and I call it mental health, I call it mental well-being as distinct from mental health. What is the blueprint really for our document? Is sharing the vision COVID proofed? And I think our National Implementation Monitoring Committee should be involved. Obviously, they implement it, but they would be key on it. That's a national policy. I note as well that the framework, the HSE physio-social framework, in terms of easing, that forms part of that. So I suppose I'm a TD for Limerick City. I've seen its impact across all the age groups, across all the sectors. I've seen it at first hand with my own family. We all have. People in college, people in school, elderly living on their own. So there is a different dimension, and I suppose what I'm asking, Minister, is that particularly our national policy document, which is the funding document in terms of how we're going to shape the future of sharing the vision, that you'd set up a policy group to make sure it's COVID proofed. And everything from now on, that we look in a world where we were living with COVID. The question of stamping it out completely, and generally it's now acknowledged, that may not be on the horizon for a long time, if ever. So we need to adapt to the world we live in to be able to exist in a COVID world. And that brings different dimensions. People working from home, lack of social interaction. It's not even, I wouldn't even regard it as mental health, it's mental well-being. Many employers are now telling staff they are not to operate from their bedrooms. They have to dedicate another room in the house for work. So my ask today is a very straightforward one, that the actual national policy document in terms of sharing the vision and everything else to do with mental health and mental health services within the HSE and the Department of Health are COVID approved, and I'd like to get that commitment from the Minister, and that work will get underway and we'd see a revised policy document published. Thank you.